As we all know that, healthcare, there are a lot of challenges faced by the healthcare industry across the world. And these very challenges are driving the need for transformation. For example, if you look at the business and strategy of healthcare providers now, the outpatient procedures are increasing, while at the same time, the inpatient volume is coming down.
In today's session, I'll highlight two big shifts in healthcare we are tracking closely. The decentralization of healthcare delivery and the rise of smart hospitals. So together, these represent how healthcare will evolve by 2030. But by 2030, smart hospital will go far beyond digitization. It will basically form an intelligent ecosystem there. Smart hospitals will use AI, IoT, digital twins to make operations predictive rather than reactive.
Hospitals are getting smarter and care is also getting decentralized. So a bunch of new technologies are emerging in the RPM sector. And with the help of various AI-based algorithms, they're monitoring various vital signs, maybe it's respiration or heart rate or overall medication management. So coupled with various patient or disease management platforms, these solutions are enabling preventive care. And to this, AI is a very central and important parameter.
Now the entire ecosystem is shifting from episodic care after the sickness care to more preemptive, proactive care side. So that's one of the things that is obvious, and it's not only on the care delivery side, it's on the payer and the health insurance side, it's on the the patients and the consumer side as well. At the same time, our consumers are getting much intelligent because of all the AI, because of all these wearable tools, because they know more about themselves than ever before.
Still in a big challenge there. I'd say 80% of, looking at different studies have shown that, 80% of healthcare data is still siloed, still unstructured, siloed and unstructured. So, moving that over the next 5 years, the advent of these technical tools is going to enable that to accelerate.
The future of healthcare since time, so we understand the time that innovation takes to go to the market. And we created a holistic approach to healthcare. So we have 3 research lines. One is the hospital of the future, life of the future, and city of the future. And we run all these experiments of new technology, new systems in our living lab of a smart city that we have here in Milan, where we have all the premises of a city, of an hospital, of a research center, and we use this as a living lab to inject innovation and to test the sustainability of such innovations.
I think in the future, hospitals are no longer going to focus on building out those inpatient beds. They're going to focus on building out the outpatient clinics, the virtual care centers, and the home health interventions, treating more patients on that same fixed asset base and keeping people out of the hospital and being incentivized to do that. And that will be the biggest driver of this change.
Nobody's saying, that we will replace the humans in this, healthcare ecosystem, but it will improve their productivity of our clinicians and doctors and nurses. That's the ultimate goal, and we reduce the burden on that.